here is an article written by an Indian origin doctor in the New England Journal of Medicine that has suggested that wearing masks not only helps to increase immunity from coronavirus, but is actually acting as a potential vaccine till an actual vaccine is found. The paper, authored by Dr. Monica Gandhi and George W. Rutherford of University of California, has created quite a stir. And it has stated the possibility of what they are calling variolation, which could increase immunity and thus slow the spread of the virus simply by using masks. And joining me now is Dr. Monica Gandhi from Infectious Diseases and Global Medicine at the University of California in Los Angeles. Appreciate your joining us. Dr. Gandhi, the article, the journal, the New England Journal of Medicine article which you authored, where you're claiming universal masking could induce immunity against COVID. Explain that. What are you trying to say? That wearing a mask actually increases my immunity?
So what we hypothesize in this paper, and we are putting forth a hypothesis, is that not only do masks reduce transmission of COVID-19 to others and also to yourself, but there seems to be observational evidence that masks may reduce the severity of disease, how severe of a disease you get if you're wearing a mask. And the idea there is that masks block out a majority of viral particles. You get in a less of a viral dose or inoculum. And at least in the animal models and some observational evidence, it looks like having a mask on will increase the proportion of people who don't have symptoms, so less severe disease. And if that is true, the good part about that is that we're seeing some very strong papers that even mild or asymptomatic infection, not having symptoms, can lead to good immunity, not antibodies necessarily, but what's called cell-mediated immunity, which is the immunity that gives us protection against viruses. And so our hypothesis is, okay, by wearing a mask, more and more mild disease, and that could help us get population-level immunity. It's a hypothesis that we've put forth.
So you're saying two things. One, universal masking will make maximum infections asymptomatic, and two, they build some level of immunity. Am I correct?
Yes, exactly right. The first part of it is that wearing masks, it definitely decreases transmission. But if you're unlucky enough to get exposed and you do get the infection in, that you would have more and more mild disease in the population. And then you're right. The second jump from that is, could we then be getting more immunity in the population as we wear masks?
In India, for example, Dr. Gandhi, we are seeing very high number of infections, but mortality rate is low when compared to many other parts of the world, including the US. A lot of scientists even looking at the BCG vaccination as a possible reason. Do you think masking can actually, therefore, could be one of the reasons that if Indians are ensuring that they keep their masks on, their immunity levels are going to rise and mortality rates will fall?
Yes, I really have been thinking about that a lot, and I think your theory is possibly correct. What I think about India, and I've worked in India and been there many times, is that the crowded situation, of course, is making it very difficult, especially in slums, for example, in Mumbai, to socially isolate and any of those things. But the one easy thing we can do in low-income settings is take your dupatta, take your sari, literally put a mask on. I mean, it is one of the easiest low-cost interventions. And I have been wondering if in India, where people are used to covering their mouth and nose, smog and other infections, could it be that our masking compliance is higher, and could this be decreasing the severity of disease and deaths? It's a hypothesis, but I agree with you. I've been thinking about that as well. One other thing is, in India, we may have had exposure to other coronaviruses that give us some cross protection from COVID.
Just in very quick conclusion, this race for a vaccine, while you're saying the focus, while masks give you some immunity, at the end of the day, it's the vaccine. Do you believe that this vaccine nationalism is leading to some safety standards being compromised in any way?
I am fearful, yes, that in the zeal for the vaccine, and I do understand how important it is because that is what will ultimately get us out of this pandemic, that we could be compromising on safety. I'm also very worried about that. I have been worried as someone who lives in the United States about the extreme push from our President Trump because it usually never is this fast to produce an effective vaccine. We can never compromise on safety, so I am worried. Yes, and it needs to stop. We need to be careful.
Thank you very much, Dr. Gandhi. Very fascinating, your study, which seems to suggest masks in themselves build an element of immunity. Thank you for joining us there from California.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.